I ran across this in the news today, and I thought that it piqued my interest and also was a good example of what the news does with healthcare scientific news. So I thought we would go over it. So this is new Israeli COVID drug which cured 30 cases of disease hailed by scientists as a huge breakthrough. All right, so if you look at this, a new coronavirus drug which successfully cured 30 cases of the disease in Israeli hospital patients has been hailed by scientists as a huge breakthrough. Number one, they don't say which scientists. It might be the scientists who developed the thing, saying that it's a huge breakthrough. EXO-CD24, that's the name that they gave to this thing. The treatment was given to 30 patients with coronavirus whose conditions range from moderate to severe. 29 of the patients were then discharged from the hospital in the following 3 to 5 days, while one patient took slightly longer to recover. So everyone survived. A protein known as CD24 is delivered to the lungs by exosomes in the drug, which helps rebalance the immune system and prevent it from overreacting to the virus. Professor Nadir Arber originally designed EXO-CD24, which breathed in as a gas and taken once every 5 days in order to treat patients who had ovarian cancer. Even if the vaccines do their job, if there aren't any new mutations, one way or the other, the coronavirus will be staying with us. Okay. All right. So this, obviously this is good. We definitely need good therapies for COVID. And I think that good therapies are going to be crucial for us to kind of deal with COVID going forward as the variants make the current vaccines probably less effective over time. And so good treatments are going to be very useful. Here's the problem. When I look at this, so whenever I see anything in the popular news, I like to try to find the original scientific paper. Of course, there is no paper on this. I couldn't find it. This is probably just reporting off of a press release that they did. And so it's hard to know. There's several questions here. One, they said that it was given to 30 patients whose conditions range from moderate to severe. So number one, we don't know what are they calling moderate and what are they calling severe, and what percentage of the patients were moderate and what percentage of patients were severe. Was it 29 patients with severe and one with moderate, or was it 29 with moderate and one with severe, or was it something in between, some mix of the two? And usually when we look at calling things mild, moderate, or severe in COVID, mild usually means you have symptoms, but it's not bad enough that you need to go to the hospital. You can just kind of deal with it at home. Moderate means you're in the hospital, but you're on the floor. You just need a little supplemental oxygen. And most of those patients do great anyway. We give them a little dexamethasone. Sometimes we give them remdesivir, plus minus, and then most of those patients do fine. They go home within 3 to 5 days. So if most of these patients were moderate and one was severe, this is probably not a big deal. This is what normally happens. Now, if they're calling severe patients that are intubated in the ICU, by the time you get intubated and you're in the ICU with COVID, you're not in good shape. And if they had almost all of those go home in 3 to 5 days, this is a breakthrough. This is a big deal. But from this, what they're saying, we don't know out of this 30, how many were moderate, how many were severe, and what are they calling moderate and what are they calling severe. And there's no placebo trial. So, no placebo trial was used in this thing. So this, you could read this and think, oh my goodness, they've developed this amazing drug and, we're curing 100% of the patients and this is great. But this may not be big. Number one, small numbers, 30 patients. You could get 30 patients with moderate disease and one with severe and they all happen to do well. That would not be unusual. And, you could have given them carrot juice and gotten the same result if they were mostly moderate patients. So you have to do a larger trial with a placebo and look at the paper and define what is moderate and what is severe, and then you'll know. So just out of curiosity, I kind of wanted to know what this was. So it's delivered by exosomes. Exosomes are little vesicles of the cell membrane that bud off, and sometimes they can carry some genetic material. Sometimes they can carry some intracellular components. So they've basically made a little sac of cell membrane and put the CD24 molecule on it. And CD24 is a cell surface protein that's been around that's been over 30, 40 years. This was a paper from 2010. So for over 30 years. And basically, it has a bunch of functions. And what they want, probably this guy was originally studying it as a cancer therapy, probably as a cancer target, because it says CD24 is broadly overexpressed in many kinds of tumor. And so he was looking at ovarian cancer, so that's one of these. So he's probably studying this in ovarian cancer. But another effect that this has is it does seem to tamp down inflammation. So I think they had a good idea and thought, well, this thing tamps down inflammation. Maybe we can deliver it to the lungs through a gas and have him inhaled it like as a nebulizer, and maybe it'll decrease the inflammation in the lung. And that may be the case. Or this may be completely nothing. It's way too early to say if this is anything. And so, news articles like this are pretty, they're kind of sensational, and they make it seem like these like amazing things are happening, which it might be. It might be amazing. If this was 30 severe patients that are intubated and they all got better, that is extremely impressive. But if it's 30 moderate patients that were just, in the hospital on a little bit of nasal cannula and they got better, that is not impressive. And it may be no better than standard treatment. So we need a better trial, and it looks like they're planning on doing that. So we will know if this turns out to be anything. My pessimistic guess, this won't turn out to be anything. But I hope I'm wrong.